Hi, good afternoon. I'm Dr. Annette Mercatante, and welcome to Facebook Live for what has been our weekly update on COVID-19 in our county. And this will be our last weekly broadcast. We will continue to be here every first Thursday of the month at 3:30 to answer your questions and talk about whatever public health issues are on your mind or on our mind. So let's get right to the data and then we'll take your questions. So as of this week, we've had 18,396 total cases. Again, these are our known cases. Best evidence suggests that for every case, there's perhaps 2 or 3 as well. So you can do the math. We have over 750 hospitalized to date. This is cumulative, and over 413 deaths. So the recovered number is in flux right now as we catch up with our data management system and get all those people that are in there as active and get them into recovered. But officially, we've had 12,073 in the recovered category. So what's happened in the last week? We've had 50 new cases. That's about 7 average new cases per day. And that is obviously remarkably down. We're doing really good in that respect. We're also down below 5% of our testing positivity at 3.6%. I believe the state is still at 5%. So we have come down dramatically with our testing positivity. We've also come down dramatically with our testing in general, testing now under 200 people a day on the average, less than 200 people a day. So not much has changed with our demographics, although I just want to point out that we do have cases throughout the age range, not just in that over 50-year-old range. We get that question a lot, but young people do get COVID, and some of them do, in fact, get seriously ill, although not nearly to the degree that we see our older individuals. Pretty even mix between males and females. Next slide, please. So this is our epi graph, and as you can see, we're coming off of that large peak, which, interesting, looks different than the first peak in December. Very different, and this would suggest different response and different reaction in our population. What we are seeing also is a nice drop, though, down below the baseline that we were at in February. So hopefully we'll see that come down and linger in that area like we saw through the summer. And as vaccines rise, vaccination rise, we will maybe be able to avoid even a peak similar to December's. We will see. Next slide. And then this is our vaccination graph. As you can see, we're kind of evenly distributed between first and second doses, but overall, the amount of first doses continues to decline. I looked at some data today. There are more first doses now being provided at pharmacies than there are through our health department clinics, but we are still providing a good amount of vaccine. What was the amount last week? I don't even know. We'll get to that. But we want to make sure people know that vaccines are still available. The Knights Club vaccine, large vaccine clinic, has been basically shut down, but we're still vaccinating. So the vaccine clinic is not gone. It's just been moved here to our main health department building on 28th and Moak. And you will see vaccination opportunities springing up throughout the summer in other summer events that are happening. So we're trying to co-locate vaccine opportunities for boat night and for other air times that are attracting crowds. So keep your eyes open and take advantage of those vaccine opportunities when you can. And then this is our vaccine map. It doesn't show up quite as nicely as it does hopefully on our website, but the green is where we have the most heavily vaccinated populations. And the darker pink you go, the poorer the vaccination uptake has been. So as you can see, we get into our rural areas, and we get into some of our more impoverished socioeconomic areas, the south side of Port Huron, kind of notorious there, but you'll see, kind of hard to see, but that is a little darker pink than the remainder. And then our more affluent communities, Fort Gratiot and St. Clair, they're in the green. So not that these aren't important areas, but it shows us that we really need to focus on areas that maybe haven't had have had other barriers, whether they're economic barriers or transportation barriers. We'll continue to try and focus our attention on those. And next is our data update, our dashboard. You can go there anytime, day or night. We'll keep that updated for you. And also now we'll be including that vaccine graph there, or that vaccine map there as well. So that can give you the updated numbers if you are so interested. So let's get to your questions. And I'll first make, let's see, what are our talking points? Vaccine updates. Vaccine and testing, I already mentioned that, are here at the health department. We are currently doing them outside, but so it's very convenient. You just pull up in your car. We are asking that you schedule an appointment on our website or call us at 987-5300 to make that appointment. We are also offering vaccine clinics and testing at the Teen Health behind Port Huron High. And we'll also be offering the same services at our health center on SC Force campus. So we will continue to try and put ourselves where we are needed. And I mentioned about the pop-up clinics, and we'll be putting those on our websites as they get developed. So okay. Jennifer, is there any other comments I'm supposed to make?
Nope, that looks good. Okay. I just want to remind anyone who's watching that if you have a question, please type it in, and we will start with the few questions that we had come in last night. Okay, the first question, Dr. Mercatante, was this person said, I saw an ad in the local paper for a hearing aid place saying new study links COVID-19 cases, vaccinations to hearing loss and tinnitus. Then it said, if you had a positive COVID-19 test and are now having difficulty hearing words clearly or experiencing ringing in the ears, call now. Can you help clarify the statement?
Yeah, I just want to thank this writer for bringing this up. I saw the ad too, and I made a mental note of it. And actually, I spoke to that company today. I spoke to their CEO and asked them what kind of information they had that would suggest that there was a clear correlation between COVID and hearing loss. And I say tinnitus, you say tinnitus. I don't know which one's right. But the reality is there is some theoretical connection. There are some connections with viral infections and hearing loss. And there are reports of this with COVID-19 infections. It's not clear just how prevalent this is or how connected it is. It still needs to be studied. It's really just a handful of reports. And so if you have been infected with COVID-19 and are noticing changes in your hearing, you please call a hearing specialist and have it checked out, whether it's directly related to the infection or whether it is the infection has unmasked an underlying issue. A lot of confounding factors here that we're not exactly sure of, but it is biologically plausible because we know other viruses can do this. Mumps is notorious for causing hearing problems, right? So we do know that it is biologically plausible that a virus can trigger some hearing problems. Now, going to the vaccine, which is a completely different thing, because as we said before, vaccines don't cause infection. The vaccine only presents a certain protein to your immune system, so your immune system creates its defenses for when it is exposed to an infection, right, in the future. So vaccines are reporting vaccine problems after a vaccine can be reported to that vaccine adverse events reporting system called VAERS. And in the VAERS system, there are reports of hearing loss and tinnitus. Which is it? Tinnitus, potato or potato? So
probably the way you say it's right.
Tinnitus. Oh, don't say it. I say it the way it's spelled in my mind. So.
Oh, okay.
So in that respect, when you look at the data in the VAERS reports post-vaccine, there is not an increased rate of hearing loss or tinnitus in that report. They're there, but whether or not they're related, and I've mentioned this before, that if they're in the VAERS report, doesn't mean that the vaccine caused it. It just means that those events occurred within a certain time frame of receiving the vaccine. So, and then we have to pull that out and take a closer look at it and study it to see whether there's a relationship. So right now, it's not clear at all that there's any relationship related to the vaccine. And I actually sent this question to the CDC because we actually had an individual call us and say, I have tinnitus and I got my vaccine. What should I do? And according to the CDC does not consider tinnitus or hearing loss a contraindication or a precaution to COVID-19 vaccinations. There is no specific indications in any of the systems that the vaccine causes this. So again, if you are noticing changes in your hearing, these are important things. You want to check them out. And if you have recently received the vaccine, tell your doctor or go to the VAERS report. We can do it for you as well and put it in so that we can properly monitor this. But at this time, it doesn't seem to be a very significant thing. But we'll continue to watch it like we do everything else. We're doing the same thing with myocarditis, right? The inflammation of the heart muscle, not clear if it's directly related to the vaccine or not, watching it very closely. So these are things that we can kind of spend a little more time on within 6 months or a year when we have a little bit more data to report on. But again, very rare. Kind of a long-winded question as answer to your questions as usual. Next question.
No problem. Okay, next question. Have you heard anything about fully vaccinated immunocompromised people possibly needing a third dose of a COVID vaccine?
Well, hearing lots of discussion about this because it's clear that some immunocompromised individuals, people who don't have strong immune systems, are not mounting the same kind of robust immune response to the vaccine as those who don't have an immune compromise. The problem is we don't know what type of immunocompromised people have problems and which ones don't. It's not across the board. If you're immunocompromised, you have a problem. So there's a lot of variability, and that being able to define that variability is obviously very important. So saying, okay, you take prednisone every day, that's not a problem. But if you have a different kind of immune compromised condition, MS or something, it is. So if we learn more over time, it is possible that certain health conditions will be recommended to have a booster just because we know the majority of people aren't responding. Remember, one of the things we really don't know yet is how reliable serology, when I say serology, I mean antibody testing in your blood. So you draw your blood and you look for the proteins in your blood that are antibodies. That type of testing, we don't know how that correlates with immunity. There are many situations where the higher the antibody, the better the immunity. And that's pretty clear. But there's many situations where the antibodies come down, okay, and you think that maybe that should mean the immunity is going away, and it doesn't. The immunity actually goes to sleep in our bone marrow, in the cells in our bone marrow, and can be reactivated and awakened when challenged with the natural infection. And there's many vaccines that are like this as well. So we don't know if the COVID vaccine is going to be one of those or whether we can rely on serology. So lots of unknown factors. All I can say is if it appears that we need a booster, as time rolls by, we'll be telling you about that and we'll be discussing it and we'll be rolling it out. But right now, I'm not hearing anything definitive, just a lot of theoretical conjecturing about maybe yes, maybe no. So if I find out something more definitive, I'll certainly share it with all of you.
Thank you. The last question that came in last night, this person said, "This is excellent info. Thank you. You're doing such a great job. Can you include the percentage of vaccinated? Other counties are past 70%. Just curious what this little county is."
Oh, I didn't see that. We normally, where do we put that? Our percent vaccination status. It goes somewhere, doesn't it? So it's on our weekly report, which not everybody gets. So that goes on our website on Fridays. Okay. And the state vaccine dashboard. So you can find that on our website. We update it once a week because obviously updating it every single day it's not the most reliable thing. It's better. And we're only going up about 0.5% a week now, would you say? Not even a full percentage. We are still well under 46%. We're barely 46%. And that's 46% of the entire population who's eligible for vaccine, so 12 and older, right? And sometimes I'm noticing they're reporting 16 and older, which is confusing. But in our case, we're reporting everyone who's eligible, 12 and older. We have 46.5% that have had at least one dose. So our goal as a community, quite honestly, is to get to that 50% mark. Because I think we can get the 50% mark, we can at least, include that with the immunity that we hopefully have from natural infection, and get some sense of idea that we may have a little more protection than we did certainly in January and February when we went into this last surge. So what did you say again? 46.5% is where we're at. Not good enough. We are clearly not even close to 70%. So come on, people. If you've been vaccinated, this is my request. If you have received your vaccine, convince one other person to go and get their vaccine as well. Just one. And if all of you reached out to one person and took them by the hand and made sure that they got that vaccine, we would be doing a lot better. We really need to get there. And we need to get there, in my opinion, before the fall, because we're all concerned about returning to school, getting all these kids back into school. There's a lot of parents that like to see kids going back to school without masks, all this discussion. And really, if we had a highly vaccinated community, the whole thing would be a much easier discussion. So please keep trying.
All right. Thanks, Doc. This is from the live feed now. This is from Kathy. Are any businesses in St. Clair County offering incentives for people to be vaccinated in relation to the rest of the state? Where are we in numbers of people being vaccinated? And you kind of already just touched that, but what about the businesses?
We can get the number out. Why don't you pull the number out for us? He's got the number. I got my guy here. Brandon, my data guy. To answer your question about businesses, the answer is not to my knowledge, unless there's, what was it, at Walgreens or one of the big box stores that was offering a card, a Reebok card. I saw it on a billboard on the way down to Macomb County. So I think maybe there's some big box stores that might be offering, but no smaller businesses. We're talking about it, but of course that is up to the business to decide that. And we are thinking that incentives could be a nice little way of pushing this forward a little bit. So that conversation will continue. And the number is 64,525 individuals have received a dose. And, we have a county of roughly 160,000. So your chances, if you're out and about, and, with the whole masking mandate kind of going down in July, remember that there's a good chance the person next to you is not vaccinated, especially if you don't know them. So keep that in mind.
All right, the next question is from Jen. She said, we were at the health department for our teens vaccination appointment today and saw you, Dr. Mercatante. The whole family's been watching the weekly updates since they started. It was like a celebrity walk by the car. So thank you for being amazing. That's very nice.
Oh, that's sweet. I'm not really comfortable on that celebrity stage, but I've been blessed with an amazing team. This is a beautiful community to work in, and it's been my pleasure to walk through this with you guys. It's been a rough year. And, I want to say that I was thinking about this today. I pray, I hope that the worst is behind us. And that just makes me feel a lot of things, right? Because it's almost hard because we've been on this adrenaline surge for so long. Just kind of relaxing is almost challenging. But I am hoping the worst is behind us. That does not mean it's over. And I keep hearing people say, well, isn't it over? The virus, clearly, I just mentioned that we're having about 7 new cases a day. We're going to have days where we're going to get more. well, it's still possible that you or someone you know is going to get infected with COVID. And you still need to know the things to do to, number one, diagnose it. So you know how to manage your disease. And most importantly, so that you don't spread it to other people. So please keep that in mind, that even though the worst is behind us and hopefully we won't see these horrible surges, we need to keep doing what we know works. And that is something that I think people don't want to hear. They want to just be over. But a virus doesn't listen to our wishes. It just kind of keeps doing what it does. This virus likes to infect people and spread from person to person. And it's going to keep doing that for a while until we can eradicate it. Remember, eradicating viruses is possible. It has only been done historically through vaccine. It has never happened spontaneously. Viruses do not go away. The only time we've ever eradicated any diseases in the history of mankind is through vaccines. And so we've got obviously a ways to go with this one. So just keep that in mind. It can be done, but it does take a team effort. Anything else?
All right, thank you. Denise asked, how many in the county are vaccinated weekly?
Right now,
changes every week, and every week it goes down a little bit. We were at 1,000.
so first doses.
First
for
doses?
last week was a little over 1,100.
Okay, about 1,000. About 1,000 doses a week for first doses. So, not zero. I mean, we're not trickling down to nothing. We have, as someone mentioned, we've been offering vaccines here at the health department, and it was a pretty steady flow today with cars coming in. It was a combination of testing and vaccines. So there are still people out there that it's on their minds. They just need to kind of make the effort to get it done. So thank you, all of you who are, and if you're still considering it, please send me your questions. Jump on here. If there's concerns that you have, we'd be happy to talk about them.
All right, Janine asks, it has been about 8 weeks since my first vaccine. I'm having health issues and can't yet get cleared to get my second. Is there any point in attempting my second one? Being that it's been some time since my first one.
Yes, it's not too late. And again, the ideal interval was based on the phase 3 clinical trials. I can tell you again, historically, that if you do a vaccine beyond that ideal time frame, it still works. And it still works, honestly, quite well. So I would still strive to get your second dose once you feel better, because I believe it will still create a boost of that antibody response. And we just talked about booster shots, right? That's exactly the same concept. Exactly the same concept. If we do get into boosters, is that we provide the immune system a boost. So please do seek out your second vaccine when you're ready. Usually with vaccines, if the interval is too short, it doesn't work as well. The second shot doesn't have, because your immune system is still responding to the first dose. And so there's this phenomenon where the second dose really doesn't do what it's supposed to do if the interval is too short, so if you get it too soon. But generally speaking, if you give it longer than that, it still works very well. And the reason they're not just coming out and saying that, because we haven't had this vaccine. We haven't been able to use this vaccine for a long period of time. The studies aren't there to prove it. But I would say your chances of it working well for you are very, very good.
Okay. The next question is from Beth. She said, will the health department recommend school-age children wear masks next year? I have seen on the news several times that it's recommended that we protect those who can't be vaccinated.
Yeah, it's a really good question, and I'm getting a lot of feedback right now from parents that are concerned about the fall, even actually summer school. So the CDC's recommendations still include universal masking, and that has not changed, although they have mentioned that they're going to update their recommendations soon. MDHHS recommendations for their guidelines for the school. They're allowing some alterations or suggesting some alterations on quarantine policies, but only if everyone in the school is masked. They call that universal precautions. So does that allow some wiggle room where if you have an unmasked individuals in the school, should they be only those who are vaccinated? In my opinion, yes, right? Because an unvaccinated individual can very, especially young people, can very clearly be infected and not know it. So there's a lot of questions here that we really need to dig into. There's also the need to try and have some consistency with schools. It's not fair for one school to have policies that allow more or less than others. And then what was the other variable? Oh, the other variable that's important to understand is that what we know about schools in classroom transmission, every published study that I've looked at, and I'm talking throughout the whole world, including Israel and some of these places we read about, all of those studies have been based on classroom settings that have used universal masking. So I can't extrapolate on the results of those studies and the safety in classrooms. By the way, most of those studies show that classrooms can be a very safe place for students and teachers to go, that they actually have very low amounts of transmission, especially in a community with low transmission. But again, they've all been done in a situation where everyone's masked. Right. So this is the dilemma that we are facing as the advisors of your school. We do provide recommendations to the school districts. They make the decisions how to go forward with what requirements are there. And so I guess what I'm saying is that we really haven't weighed in completely on this. There's a lot of things here to consider, and I am hoping over the next month or so we will get some better guidance and some more information that can help us with this decision. You are right. An unvaccinated individual in a classroom does pose a risk to other unvaccinated individuals. Now, I just mentioned that even a vaccinated individual who's immunocompromised can actually be not very well protected. And there's no way right now for us to know that. So there's another little wild card. And then another little wild card is the variants. Okay, so we have variants that may or may not end up being a little bit less protective from the vaccines that we have. So far, not so much. So far, all the variants we have good protection with the vaccines, but that could change. So some wild cards out there that are also going to make it a little harder to decide. And of course, we want our schools to be a safe place for everyone who chooses to do in-person learning, not just those who have strong immune systems and are vaccinated. So let's just keep that on the burner. It's on the front burner, and we're talking about it. And maybe next month when we come back, we can talk about it some more, because it's a hot topic. And the most honest answer I can give you is that there certainly has no decision that's been made, and we're still sifting through a lot of the information that we do have to try and figure out best practice.
Okay. Next question is from Deborah. She asks, is a vaccine okay for my grandchildren that have PKU?
So there are, so I'm assuming they're 12 and older, okay? And there are no contraindications to the Pfizer vaccine other than allergies, pre-existing allergies to the vaccine components or to the first dose of the vaccine that you received. Okay, so whether that's a genetic problem like PKU or whether it's an immune, there's no. What we can't say is how your grandchildren specifically will respond to the vaccine. I would have to research that particular, but I don't think there's the bigger concern is the immune compromised individuals with the vaccine, that they just may not respond as well. I don't think we would have that same level of concern with an individual with PKU or another metabolic problem like that. And I don't think there's anything in the literature that would suggest vaccines are a problem with metabolic disorders. But I will make a mental note. I'll look at that and try and get back to you if there is anything in the literature. But I don't believe so. I don't believe there'd be a contraindication to that.
Okay. Linda asked, is there any booster information out yet?
Yeah, you know, that's such a hot topic. We had a question just a little while ago about that. Stay tuned. You know, a booster is possible because we know that the variants are changing. In some cases are changing our ability of the immune system to recognize them as well from the original vaccine that we received. We also know that boosters are possible because we don't know how long the vaccine immunity will last. In some situations, vaccine immunity lags. Although I gotta say, so far the literature is very, very reassuring, encouraging, exciting that this immunity is going to be very long lasting and very robust. So it's possible that a booster might only be needed if the variants become so changed that our immune system doesn't recognize them anymore. Kind of that's what happens with influenza every year is our immune system just doesn't recognize it because they mutate so differently. I don't know. Hopefully not, but if we do have to do boosters, it's not like it's impossible to do. It sounds like something that we'll be able to pull out and push out pretty quickly and pretty easily.
The next question's from Rhonda. She said, a fully vaccinated patient was scheduled for cardiac valve surgery, tested positive for COVID pre-surgery, was informed a 90-day wait time for next surgery option. Can you explain that rationale?
No. An infected individual, you can get an infection after being fully vaccinated. We do know that. Hopefully that individual was screened with a PCR test, which is a little more accurate than our antigen testing. And if a person is infected, they should remain in isolation and obviously not receive an elective medical procedure for 10 days, right? That's the duration of infectivity is 10 days. And that's not to say that if there was a necessary procedure that it couldn't be done, right? If there is an emergent procedure, you can do these things, but everybody involved would have to take the necessary precautions. So I'm not sure where the rationale came for 90 days, to be honest with you, unless that was a surgeon's call, wanted to make sure that the person had none of the long COVID type impacts. We know that sometimes COVID infections can cause some myocarditis, some inflammation, things like that. And maybe the surgeon just wanted to be absolutely certain that they were outside of that window.
Okay.
That would be a healthcare provider question.
Tiffany said, John Hopkins' study on a transplant patients is recommending a third dose. Locally, transplant centers, Henry Ford, Northwestern University, are not. Do you think the CDC will rule on this so that patients could seek a third dose of Pfizer?
Yeah, that's interesting. And Tiffany, I am not aware of that. So as usual, you are my public health sidekick. Thank you for that. I'll look into that. I think CDC will weigh in there. CDC is weighing in slowly. I would think we're going to have to look at NIH and some of the independent papers to kind of see what's going on out there. Transplant patients are unique. Obviously, they're immunocompromised on purpose, so they don't reject their new organs. And so they have a unique profile that I'm sure is being studied separately from the general population. So please don't interpret, what's being done at tertiary care centers, high-tech tertiary care centers, and what we are recommending for the general public. It wouldn't be the same.
Okay, the next question comes from Mandy. She says, how come my mom's COVID vaccine card already has her booster date set up for December if everyone is unsure if vaccinated people need one?
I don't know. We don't put booster dates on ours. You should have, if you got Pfizer or Moderna, you should have 2 doses, right? Mm-hmm. Pfizer 3 weeks apart, Moderna 4 weeks apart. And beyond that, there is no recommended anything. So I don't know why anybody would put another date on there. I apologize. Lots of confusion. There's a lot of discussion and confusion out there. I was talking to a lady today, a pharmacist, and she works at 5 different healthcare providers' offices. And she said, we were having a conversation about all this. And she said, yeah, every healthcare provider office is kind of got a little bit of a different response, a little different answer. And that's, obviously very concerning to me. It's new and it's novel and it's emerging and it's changing, and so it's going to take a while for the entire healthcare system to kind of get on the same page. So I would just say before you seek a booster or a third vaccine, that you make sure that you've got all the right information before you do that. Right now, 2 doses. That's all you need. Okay? No more than that right now.
Mandy, she also commented that she had her vaccine done at the nightclub. So I'm not sure.
It was us that put it down?
Yeah. Mm-hmm.
No, that's something we would
Not
have
sure.
to look at. I'm not sure. Mandy, make sure you set up your information to us, and I'll double check that, and we'll check your MICR system and make sure. Honestly, I can't answer that question. I don't know why our staff would do that.
Okay, Janine says, I'd also like to give, Elise just brought up a good point. It could have been the expiration date for the vial. Maybe that was on the card. Not sure. We talked, anyway,
Oh,
not sure.
okay.
Okay.
Maybe you could take
Janine,
a screenshot, Andy. Maybe you could take a screenshot of your card and send it to us.
that's a good idea.
You know,
Mhm.
at COVID-19, that's a secure email, just comes to us, nobody else. And maybe we could take a quick look at that and see where that discrepancy is. It's confusing to me. I'm sorry, I don't understand why that would happen. So we'd like to clarify that and make sure that if it wasn't an error on our part, that we could make sure that we talk to everybody about that.
Janine said she'd also,
any errors. We never.
she'd like to give a positive comment. After only the first vaccine, I did test positive for the antibody. I also tested positive on the IgM. So that means current or recent infection, correct?
There you go. There's the problem with serology. So typically in a normal viral infection, IgM is acute phase. Antibody is the first one to rise after an infection, and then an IgG is the more sustained, called the late phase. And in some viral infections, we have a very clear understanding of when you see the IgM and when you see the IgG and how long they last and when they intersect. We don't have that information with COVID. We don't know when the IgM should rise and when the second wave of IgG waves. We also don't know with a lot of serology how reliable it is, because there's again the wild, wild west out there when it comes to testing. So there's the uncertainty of where you had it tested and how reliable that was. And I can't honestly tell you whether you would see an IgM banned from a vaccine, but you might. Good question. I'm this is kind of talking to myself here a little bit. So the problem with serology is exactly that. We don't know how to interpret it. So you might have had an acute infection after your first vaccine. That's quite possible. If you felt ill and you had a positive COVID test, an antigen test and or a PCR test, then you likely had a wild infection despite having your first vaccine. If you weren't ill and you didn't have a positive COVID test and just got serology, the serology could be from the vaccine. Okay, so and I'm not sure which. I don't know whether you had a positive COVID test. I didn't see your. Maybe did she mention that, whether she had a COVID test or not?
She said, after only the first vaccine, I did test positive for the antibody. I also tested positive on the IgM.
Yeah, and IgM is an antibody. So what she's saying is she got her antibody test. That doesn't, again, I'll go back. You could have a positive antibody test because of the vaccine, or you could have a positive antibody test because somewhere along the line you had the natural infection. And I can't tell you one way or the other whether it's an IgM, an IgA, or IgG. We just don't have that kind of knowledge base yet. So what I would do in that situation is get your second dose of vaccine as recommended. I'm assuming you got an mRNA vaccine. Get that second dose and don't worry about your serology. And assume if you're a healthy, immunocompetent person that you have protected yourself the best way possible by getting both doses of the vaccine.
Hey, Doc, she did follow up when you asked those comments.
Oh,
She said, I
okay.
was sick 5 days. She said, I was sick
Sick.
5 days after.
Okay.
Still
Okay.
fighting to get over it. Test was negative.
Test was negative.
So she-
Okay. So again, you could be sick because you were having some, adverse problems with the vaccine. The vaccine does make people feel ill, although not usually for 5 days. Usually it's just 24 or 48 hours. I don't know, babe. I'm sorry. That's a tough one. And again, I don't know that the serology is going to help you know whether that was positive because of the vaccine or positive because of a natural illness. I would follow through now that you're feeling better. Hopefully you're feeling better. I would follow through and get that second dose of your vaccine in, and at least then you know that you're protected going forward. And remember,
And
a lot of especially our antigen tests, can be falsely negative. If they're positive, it's usually positive, but they can be falsely negative as well, depending on when you have it done. Even PCR tests, if you don't do them at just the right time, there's a window there where you can actually have had an infection and the PCR is still negative. So these tests can be a little bit hard to figure out completely.
And Doc, that Mandy, she followed up too and said it was her mom's card and she would talk to her tomorrow and follow up on that.
Good, good. Please
Oh,
do. Yeah,
oh,
I'd like to know that as well.
I don't know if Beth had a question or she was replying to somebody else's, but
I love the chatter on Facebook. Isn't it fun?
yeah. Um,
I don't look at it anymore, to be honest with you, because it kind of drives me nuts. But
the person who had asked about the masking in schools had made a comment that they noticed that their kids did not get sick with any other typical illnesses from wearing the mask, and their kids didn't mind it, and wondered if that had any correlation. Do you think so?
absolutely, absolutely. Most of our infectious disease experts and epidemiologists feel that the low rates of influenza that we saw globally were because of our mitigation strategies for COVID. In other words, many, many infectious diseases can be reduced by wearing a mask. Right? Now, I had somebody say that the mask was nasty and it caused some kind of. Please don't wear a dirty mask. Okay, a mask should be washed every single day. So have a nice variety. You don't want to keep putting a mask on because your mouth is got germs in it. So please wear a clean mask every day. But there is no question that it's not going to only help you prevent COVID infection, it's going to help you prevent a lot of other infections as well, especially the ones that are transmitted through respiratory particles. Probably not the ones that are from like strep throat, things like that, because that's not really respiratory. But certainly some of the other viral respiratory ones will.
Okay, and Janine commented back, thank you for all the info. You guys are amazing and so informative. So that was nice.
Thank you, Janine.
Okay, so it looks like we're all caught up with the questions that I see. So how about, because we won't be back till July 1st, what advice can you give our community and people watching, Doc, about what they should do this summer? Well, as far as staying
number
safe.
one, be aware that this has been traumatic for everybody. And I've shared with you the 5 stages of grief, right? Denial, which we still got some people in denial, but most people have moved on to bargaining, anger, still got a lot of angry people out there. And then there's acceptance, right? And so we need to keep moving on with our emotional health. It feels strange to be doing things again. And just remember that if you are unvaccinated, you are still extremely vulnerable. There's still a lot of viral transmission going on out there. And if you are unvaccinated, please stay the course, wear your mask, keep your distance. Now, if you're vaccinated, you're not like golden, right? I mean, there's a good chance that both a vaccinated or an unvaccinated person is not going to be a particular big threat to you, even if they're close. But do remember that there's no vaccine's 100% effective. As we just talked about, some people don't respond to the vaccine as well as others. So if you start feeling ill, don't go to that bonfire. Don't go to that pool party, stay home, get yourself tested. Okay. If it's negative, stay home till you'll feel better and then go out. If it's positive, you got 10 days before that virus is considered no longer transmittable. So we've got to just keep walking that walk, people. We got to keep doing it because we just don't want to see another explosion. I know another explosion this summer would just, I think, just knock the wind right out of our sails, especially now. I think we all feel just like, oh my gosh, right? So let's all do our part and just kind of, enjoy the summer, but use your head. Just, why am I all blurry like that?
I don't know. I guess that means it's time to go.
Time to go.
All right. If anyone has any questions, they can email covid19@stclaircounty.org anytime, and we'll answer those. And also you can call our informational line, 810-966-4163. And we'll see you on Thursday, July 1st at 3:30.
Thanks, everybody, for tuning in.